dua shows ma honhom no ma meka no ho enema e beboa yen fa apomuden ho awie bremu me sure se fa no so ne fa mayen ma yentimente as ensem nyina ase so the be bitimi di aboy yen ho bra e be me ye ne afri na afenso ye betwe yen ho afri ohaw ne amane ho na ankofa one bia amre yen e we nipadua mu de yesre wanwumre nyina na set wani tre yen ma honhom no meka yen nyina ho ma honhom no ma meboa yen na ma honhom no ma medi enim anwumre na ma udwumadie nyina no enwie mu nkunimdie mu na se wie mu nkunimdie mu a de ayeye ne na ase ma odin kronkron no ye da waseso atie so ahira yen nyina anwumre wo wadom ti amen
amen apanyini wusu ye da wasepi emma se de enra meka ho asem no se ene e beto aso de disua no aba ene de beka ho asem no eye spine head eye nipa wachi ohoi wachiri bremo no eye de esemu no eye wo spine no na se spinal cord no ene ye ka se ene ho asem na e ade a ye beka ho asem na ansa na kra na meyi nipa no a obedi edwumade anim akyere no na me fakonya yi so ama adofo a omonye first Ghana asafoma eni adofo a omonye SDA fo ayatu ensa from abalai so nyina mo nyina akwaba edem ase se atu ensa from mo mutimi ba lai so na mi nhira mo yi pass apomodin adesua de ba no mo nso no munya so mfaso na mkoso amra ye watede ai de bechem akopon bo a wachina ye bobo mo mutim ba ye nyina din na akyede a ho no edema mo ntise mi mbobo mudin a mama no ha mo kra ye de pamu no be bo mu nyina mudin maako akyede a ho no so no ede amamo na ene yema ni GP se enya doctor ni panyina ode adesua yi ode ebre ede pa ase ye benya ni petitu sei botun ho si ho se obechekere ye because enye easy ana omo epe enafo na yakopon adonti no enye okunni sei man de desua ode ebre ye Dr. Justice Usu Agyei Dr. Justice Usu Agyei o medical school ase ewo Albany ana ochire oto aso eye residency esa ye ni fellowship bra me no ka say Dr. Justice Agyei a board certified neurosurgeon and specialty ni pa no ewo spinal surgery so because wachi bremo ho no ho pa ne specialty nti ade a waben ho pa enti ene yemani GP say inye ni pa o so obinfu say na one ode adesua no ode ebre na Dr. Justice Agyei oye first Ghana asafuba ankasa ebia na school ne yinti no imu pii wo bia e hada ehunu ba ene nyina no yebi hu no na omami ni sister Joyce ene opanyin dan Agyei mi se ma ba asafuma kyerɛ de nyina no yenim sa opanyin ene de yire na oye walini a wo ba nso no baako nyakopon encha de encha pii kura na onyan aso pass in the board a nyakopon so aye na dom aye se when adwuma ewo St. Luke's Hospital a ogesia no o hyase a o se okoye omo first ever spine specialist nti yinga easy se benya obi o spine specialist na oni abekasa ne emene GP se nya Dr. Justice Agyei nse Dr. Justice Agyei also a me hu se woso boso video no na ye hu ene em wakwa ba ase wa meet you ho
Moteme
ye tito ne pa ade osafo mo wakwa ba.
Thank you.
Did you say what like a tree there?
I mean, Kacha will say there are times I hear translator.
All right. Like you be comfortable be out. What be use? You say you bet yes. Yeah. That was say a 2 and safre wa would you 2 more me say you're very busy pa na so no o de beto ho ma ye ne a ene on the otmini ahia o de adesua kunni say e de ebre that means that opi on ka ho no mo no ko so entum onum die mu me hu say apostle board na enche bo se dwuma se wo St. Luke's na me de pa e that means that sa won e kwese sa emaye but me say the journey is not easy but Nyankopon adom ti no o de watcha that means that any mesre ema opani Alex Agyei abo team song na amaye team song no esipse pa ni pa betin ne Dr. Justice Agyei ne
You doing your best to turn from sin. You think you're the worst, but don't give up. You never know. You know your own. You'll be faithful to complete it in you. You doing your best to turn from sin. You think you're the worst, but don't give up. Never alone, you know your own. He'll be faithful to complete it in you.
He who started the good works will surely bring it to completion. Give it all your best and leave him the rest. He will do. Don't forget to read his word and lean him daily on to prayer, trusting every day on his promises. He will do.
You've fallen again, you've gone astray, but Jesus will reign if you give him your way. Calling to you to take you through. He'll be faithful to complete it in you. You've fallen again, you've gone astray, but Jesus will reign if you give him your way. He's calling to you to take you through. He'll be faithful to complete it in you.
The Bible tells us in the book of Philippians chapter 1 that he who started the good works will surely bring it to completion. So no matter what you're going through, be rest assured that your victory is secured. Why not sing hallelujah, praises to the Most High God who reigns on high, for he's worthy, yes, he's worthy of our praises. Hallelujah to his holy name.
and Dr. Justice Agyei na sa radio bijemu emao nyame enka ho onhyira na oma lesua ode brere nyina no nyina yenti ase na me kai tie fo so Dr. Nusia any questions no ebetma pagya yansa anase betumi atype no chat nim ni nyina no yebe ready ama yetimi answer nyame enka ho na adom nti amen.
Everyone, mote de Americano.
Yeah, two kapa.
This is my lovely baby girl.
Oh wow! Congrats.
Thank you. Okay. I like the theme music because you're nervous. Music and now calm all down. As we start the presentation and you're too anxiety provoking. So me doing Justice Agyei, me mommy, Joyce and Daniel. Right now I'm in Buffalo. I'm finishing my neurosurgery residency in Timmy. I'm in St. Luke's, Pennsylvania. Yeah, me start here Juma August 1st. So okay, and that talk I may be given before. Now me journey home say message when I'm sending me fan mamo. first, me think I say, oh, me can't something about the brain because okay, neurosurgery. The first thing will be brain. Oh, brain. But in actual fact, neurosurgeons yet 60% spine, 60 to 70% spine, only 30 to 40% in a year brain. And brain is so broad. And a message I may hear free brain in the amamono. Only thing I can make say bit to me I change your life is stroke management. But no, they make a show and say control blood pressure, not the control diabetes, and no high cholesterol. Stroke risk be low. Then that's it. And a bar say, oh, maybe a spine specialist. I didn't make a spine once because obien ho we are say on have at some point in their life neck, the con and other ne cheek pain. Now pain a bar for variety of reasons, and for most of the time, obia a reason to more pain. Until lesson where to one. Teach you guys about your friend is saying spine. Make show spine anatomy, So maybe here in the way say BB how ubetimi adwene ho say oh when you're wrong and I say when you me e bia no ntina menya pain no into me show anatomy ni we are no much way spine no it change over time. So your wowa or spine is different. I say, oh yeah, 20. And after you could do 40s, spine is also very different. Now if I talk about some causes of a pain, about spine. Now if I talk about some treatment, say obey a friend conservative treatment, a treatment involve surgery. Say obeko chiropractor and also we have physical therapy net sane man. Making now my finish your talk and then with some surgeries you bit me idea help more a type of pain and a prevention in the bit me use sene be sa pain. Into anatomy course 101 or spine a very complex into a picture where my show in 3 different views. We say yes or shape if we are nimona say now spine it here. Now say now so shape from side and up on say a curved, and the reason that a curve saying because uti ewaha na uti it was a rested pelvis. Any or legs, in a straight line, so that everything a balance. Because so spine a balance and everything move together in sync. Into be a offer after there happens so not pain man. Okay, now some basic anatomy or spine, you're breaking it down for you guys, and you're breaking it down to 4 main parts. Okay, 4. First, cervical. Second, thoracic. Third, lumbar. And fourth, sacrum. Okay, now the reason to me different, even though me the same spine here, because so go away from cervical and thoracic spine where you look only change it. So cervical now bones in here and kitten. And I think so start upper cervical bone is different. And it different because sa ring away a help us and a bit to me turn on neck. Into other part of your spine, who's intimate in rotate where our neck is rotating. Because of where C1 and C2 netesono. And I think so numbering main numbers So cervical spine was 7 bones. Or called thoracic it was 12 bones. And I call lumbar It was 5 bones. So o count to first cervical near C1, second is C2, ecopim C7. Now if we start thoracic at T1, now if I could T12, and now a lumbar from L1, ecopim L5. Now sacrum, a fuse, meaning say bones in a carbon into a no encounter. I said one big bone. But the most place are a moving a cervical, upper part of spine. Now if thoracic and a move CBA, and if lumbar no a L1 to L5 a hona a mawutimi bendu waist a cut all the way down. Intina, your friend is saying so osha spinal diseases are most of the time and it happen what lumbar and this cervical because some places in the move cassette. Okay. Now another thing I also you take a look at and the spine each level you're different. So we will show a thoracic level spine. And the reason tell me show a picture away because sani ma way when a joint was spine. Every spine was a joint way, and after a joint and then allow for spine not to go from one level to the next And the other important thing they say rib and so attach your spine to give it more support. Into knowing say joints our spine we are very important because a no allow move and I think so say a bad diseases are say way unya arthritis knee and I say elbow and our hip. Same thing the unya arthritis was spine because of jointing. And I'll show say spine wings where you're different. A lumbar spine, a broad, very different from a thoracic, And I think so me show we because says spine, aside from jointing, the next thing I also talk about here a disc space because jointing is stacked on top of each other and the mouth or spine link it together. But it cannot work if it doesn't have the disc because disc, fluid woman and the mouth or spine bouncy into say jump now could see jump now see for my when they allow our spine move send or bones and then crush it together into discs very important and also it becoming a source of a pain said disc it becoming disease and a way a picture of the disc so disc anatomy most people don't know this said disc even though say what the whole spine there were 2 parts. First part fibrous meaning say a very very tough tissue and actually inside the knot I very soft. I said it was a lot of water into a very soft and no ever try away a disease of disc and about later. The next thing it give you spine support ligaments. Ligaments, connective tissue is what we call it. So here spine now, and there might be brain holding it together. So we say where your ligament it go away from uti when I say now travel all the way down to sacrum, all the way down. Now sab band the way another one it was spine nechi honum and it travel all the way down. And I think so in between bones way sab bones way now. So feel it with chia, feel it sa bone there, where your friend spinous process. Sa bones in so connective tissue a holding in together. And I think so and when I make I say a line it spine that chi honum, spine that chi near. And that ligament, now if I connected to disc, it's very important. And the nyame boy, there's nothing in your body and require a nerves. Or making sure say everything baby your friends and spinal cord, any brain tenor, it also protected into spinal cord entirely. Nina will born into sa canal way na spinal cord te. So share hanuma sa canal way nete. And all around it and you're protected. And I think so Osha won't say your friends a nerve root, nerves I control body no and a PA free side of a spine no nerve root a PA free ha na PA free ha na PA free ha into every level make sure we say a nerve. And that make us say a very important say a spinal cord near protected. Into say open so yes surgery or spine and not spinal cord. You cannot get to spinal cord without removing bone. It's because say it was you're protected. Because you're very important, and I'm going to show you why. You know, so brain, internal brain, or skull, they protected them because our brain they control everything in our body, every single thing in our body. And the way our brain control everything in our body, you know, you say a brain, a fast spinal cord. Now, if a spinal cord not sending nerves, I call body munina. Nerves they not carry message of the brain, and then they call all other parts of your body. And I make out to say a nerves every level nerve it exited the spinal cord in every single level, and you can see it here starting from where the top of your brain here. Obat a spinal cord nerve C1, C2, C3, C4, C5, C6, 31 nerves and the exited spinal cord. Okay, and I'll back down how no ma once a exited and a thoracic, you know, a wrap around a fat when him no chest honor. The two important parts to look at, so we're thinking about nerves are a hanum and a hanum. Important because nerves in the vertebrae coming together. Now for my form will be your friend brachial plexus. And a free hanum nuna a given nerves are a cut on some. And I think so share hanuma nerves in your coming together. Now for a given nerve kakakaya be your friend, and then your friend a sciatic nerve on it. He said obi it was sciatica almost say oh sciatica because say nerve away no and it causing nipa no pain no into then I make nerves in your free or neck now for combining together now for cover on some and almost the nerves in your and cut down now. Supply muscles that want or arm and the nerves and the muscle a year juma and I feel so nerve no and the mouth sensation of feeling or body munina and I on nine no nerves and they coming together now feel give you sciatic nerve no sciatic nerve in the control your muscles that want nine munina into so move what some nerve way no a casatro body no a casatro nerve or muscles no send be ya or nine be move into say a memano say o tina o care muna the wallet to show to now say o drive o sign after or to and I say or 9 a number because a wallet and it presses our nerve away and Emma was a numbness and a pain. Inti me afa me drive one me share me family wallet and share me bottom me the top me dashboard to send it be and cause me issue be then I can before no nerves and it coming out say almost supply muscles only nerve no give you sensation say oh no aduane na do o de onsa echo to stove no so na stove no so e share oh no in your pain because nerves in a free a animal call on semono and a supply sa sensation into u feel sensation I want to send a message that come our brain or brain is say hey shit you unsa no way you unsa and I say so call outside not a what they were same nerves and now they feeling cold you know now ma wakasa through brain say hey I wom yemfa jacket and share Oh, into nerves and then basically control everything I'll be piano. Nerves in the control. Okay. In sensation, this becomes very important. Sensation in your perennial region or private, free a nerves a free or spine and a supply you a places and this is a from crana neuroscience and as a neurosurgeon. This is why I love this field so much, because there is not a single thing a whole body that is not controlled by nerves. Every single thing is controlled by nerves. We say our sweat gland. Say best sweat cry a nerve through spinal cord it called blood vessels in the and no sweat gland in the mouth sweat. So blood pressure because nerves in the free or brain stem called heart and the catcher and say pump a blood in the core body. So obey exercise no a catcher and say it was a beginning say you increase the blood in there because your muscles and one say juma so breathe out. Larynx are controlled by nerves. The other thing, bowel function. So obeko toilet so obejun so nina and I picture where you'll be a penis and then a genitalia. Say obejun so obeko toilet nina controlled by nerves through spinal cord. Into later no mekacham say obi a konya car accident. Na se or fracture the spinal cord wahanoma. Ne lungs enye juma. Ne heart enye juma kese. Ne blood vessels enye juma. And after so untimin control ne bowel and answer ne bladder into imbonse ebinine Johnson no answer echo because untimin control. And the spinal cord it becomes very important in the way that your entire body functions. So because they're so important, that means they require support. Now the support in your bones and joints, discs, but next level of support here, muscles. And this becomes important. So prevented a spine pain. Also muscle support around the spine. It protects your spine from breaking down. Into some muscle way, longest colli. It going from or neck, a slow hand now all the way to your friends or thoracic region. Now it give us spine support. Now for side the hand of my muscles when you deep in your neck. And then give you support to your spine. More muscles they give you support. So it also helps you move your neck. Will protect your neck. Now we'll show a back out. Also we'll show a back out. Andrew said back muscles were muscles were a lot of muscles and so we some muscle way out if we honoma. All the other muscles they go honum yet for spine support. Ni now wrap around the spine. No, send it out. Move some muscles in the help our spine. It move it keep our spine stable. And deeper muscles and getting I attach it to spine. No, send it a mass spine a strong. Other muscles are engineering here or abs or abdominal muscles. Exercise or it also remember our abs because very, very good support of your spine coming from our abs because then they help you keep you upright. And I feel so strong back muscles are not strong ab muscles. I won't say you keep you upright and every out spine and move in a funny way. Yeah. Now I feel you go deep into the abdomen. Another muscle, a psoas muscle, known as a wrap around spine. And some muscle way echo attach your leg. Into so we say raise your leg. Some muscle way a raise your leg. Into obi crunches, no air crunches. Some muscles way in quano more exercise. Omunim said this is the muscle and exercise more. And it become very important until we crunches and help abs and mouth 6-pack and quan. It also no a help or spine because our muscle it give you support to your spine. So now that I are going through a anatomy, no, I also understand it how our spine no age. So yeah, and I say also spine is very, very straight. Now fe no or muscles it becoming weak or ligaments it start to break it down. Now fe will joint or spine also break it down. The nina happen now fe or spine need air curve. Now fe we older na I say. That doesn't mean say a bad thing because everyone in this world it be agey. And this is normal, but it be no agey more than other people in terms of way almost spine no aging, and that can be because of many reasons. So number one reason our spine it beats me aging faster than what down for. It be create your family history. So papa it was scoliosis meaning so spine a curve that means that you too at some point it be scoliosis. That means high risk so scoliosis. Next thing a juma all lift heavy stuff and also exercise too much because the spine it protected lifted all the heavy stuff into every time I lift the heavy stuff will put more pressure on your spine into helping to break down faster. I just say obia or run it all the time. Or nina knees ebe money issues and on hip ebe money issues because arthritis it build it up too much. The next thing is obesity. So obi kakraka. Remember say no matter how big or spine size ain't changing. Or spine new remaining the same size. Until only thing it changing your fat and near me a wall or honam no and it changing. Into so you can see too much and I say or spine into mean support too waiting anymore. That becomes an issue. Okay, and all those things it beats me a help, it beats me a push you be say obey agey faster than other people. All right, so the first process of spinal aging a disc. So me can say disc, a nice keep a space between a vertebrae, very nice. So we move where no keep bouncy. Send a our spine and rubber and cause pain. But when say we are younger or disc and they are nice. Outside near tough tissue na American and the inside near water. I say in so and I say jello ne go inside and you're very healthy, meaning say keep your spine not bouncy. But once a water ne dry and so ne dry and afe or disc and when you're friend disc degeneration. Now way happen nafe a causal disc collapse because the happiness a losing swono not the next thing you know now if I shrink it now if it was spine instead bones and they apart from each other that doesn't happen anymore. Now if it bones and rub together into way na yet disc degeneration say way a normal disc now if I start to say it go through degeneration. Say losing so near woman. A losing so no one say a spill it out. On say any friend of bulging disc. We be on the moment say, oh, me was bulging disc on my neck and I'm more bulging disc on my back. That means so disc and then start to say a spill it out of baby a tino. Now if it say onye luckier. Disc and it to me a peer free or back on them. Also, I know my nerves in it travel before we call body no. Oh, into a disc in it coming out na hit a nerve na and on a pain no. We say a very, very late stage disc degeneration. I say, your friend is saying the disc is almost all completely gone. A hand there, a completely gone. Say bone, a rubby on bone. Into yes, and it beats me. You're very, very painful. So we a picture because me person mo tears here. Oh, we are surgeon and I said doctor betias here. Me person mo te I said we your spine. Oh, say me ka say each level of spine nerve if free honum. Till sure disc no hanoma. And a way your chi. Sa bone we no feel your chi no. Or spinal cord ne te hanum ne because every level nerve if free hoba eba outside. We are normal. But so o disc in this start to say scoliosis outer, not a hit nerve or not. When it causes pain, no. It causes very, very severe pain. Now pain there, bebano, if follow nerve way, baby, a bequaco supply, you know. So into nerve, you know, a nerve supply, then say chi, a mano feeling. That means that nerve a compress, yeah. Me say me feel it. It be one more feel it hot, cold. It be a friends say I want him, and so once on side cold, and I said pain issue to a through neck. A cold on send him no, and no because it couldn't be because disc be disc and I say be before for a presses our nerve no, and Emma or sa pain. This is another picture showing different ways that a bit me affected. Way you will be way a neck. On say a bar once I hit a nerve no. When it believe lead to pain. This is me patient to be MRI. So a disc, nice height. A white initial will say fluid a woman nice, a normal. But oba hanoma on say fluidness that is say changing. Into a changing that disc and spill out. And also share hanoma spinal cord and about down. And an air cord down into nerves and knee pain about. But oba hanoma won't say disc you know. And a hitting nerves in Indiana. Until any power say, so obeba clinic, me pain a started or me talk once I talk on name about me to me move me to me walk up because pain is so bad. I mean to me yashe. If you know I want to make a dream because pain is so much. To me baby. Into we say no, me evaluate it. I figure out treatment for that person. The next thing, no, so I said spine or joints. Joint be a wall body mean be a risk of degeneration. Meaning say my elbow, me any say 200 times a day. Me can be I said 5 years later, no, so elbow way be me pain. It's the same with your spine. Or spine say move you say so you too much anything joint in the bed wear it a be my pain sanity into we say shot joint a stack it and arthritis bad joint to him into nipa we say BB now your friends say we now or be bad how catch you say more pain woman cheek. Now, or spine it going through degeneration now, and I say age, you know. Another thing a bit me happen here. Your friend is slip vertebrae and our spondylolisthesis. Say or spine it bit me as slip or forward. So or shit posterior line where you are and match it way say no whole spine as shift or forward. And an MRI way is showy slippage, you know. So way happen nerves are efa hanom nyina cut down hanom no. It get it pressed into way happen a bit me amount of pain, a bit me amount a lot of back pain. The worst thing I bit way bit me the amount near said some nerves they low hanom no. Some nerves way in a supply or bladder, a supply or anus, and a supply or rectum. Into so be ube so be called toilet or some nerves in the supply into some nerves and they get affected that untimin control ubini and also unsobio na fe or kowa egu honum into so bibisa happen at a emergency also occur hospital send be abinya a surgery. And another thing a bit may happen aside from slip disc, you know, a friend of spinal stenosis. Into what down for be over catch me was spinal stenosis. So me the normal picture at on chain. Say be ube who style was a spine at here. Say we say no a white in a woman a fluid, meaning say disc space in a healthy, a young, a healthy. On the height and nicely high, but obahanona disc we say there's no more disc. A degenerative. And because disc and I spill out and spine and so I shift it. Into yes nerves no and a disc and a hit no. And after over level way so a same thing and hit it. And away and so hit it into any power way say so banana symptoms need severe someone it was a surgery man. There's another things we may show we a lumbar stenosis. We a lumbar stenosis. Stenosis meaning tightness. Once it be tight. And away a lumbar spine into unya stenosis any friend of a lumbar unya tightness a friend of lumbar stenosis. And same thing some got to almost said or neck or con and it low back which and then they move with the most into say arthritis beba or neck and then with chino and the beba the most. And I feel we saw here picture where almost said a disc and then you're healthy. So here disc way na yet somewhat healthy, but usher we are a degenerative, and a hit it spinal cord. Say usher a hanum na brain wano nipe nitini was throw hanum. And our brain it give you spinal cord no it our brain way our brain no spinal cord ne kasa a spinal cord near direct continuation of your brain I call spine name into social hanumas a disc any arthritis ne hit spinal cord no into instead say cord never travel straight na fe turn in different ways. Into side nipa way they're gonna have a lot of trouble. Because and your omun sankwan be affected omun nine way omu be walk. If you want to call omu bow or omu bladder be affected. And I feel so in nipa way they sometimes the yehune say way happen it makes you unable to walk properly into walking in your good. So walking in your good, what happens? Or falling now hit to tia. Now so every baby now fe a dingo spinal cord into the sometimes the who say you when your old person be 65 years old or say oh now me walk downstairs and I'm falling I'm hitting my head. No, I bet why you're paralyzed because already no all of this bad stenosis on the neck and after hitting in the head I was jerking the spinal cord and after the whole spinal cord in your juma now why you're paralyzed into nipasa no ba a hospital a emergency or say I didn't call OR Senebeya, you be remove bones away in Senebeya, but my room for spinal cord to breathe. And he said, oh yeah, one of the unfortunate people now said, or spine, it going through too much arthritis, when it bit me happen. And I think so say, oh yeah, nipa, oh yeah, predisposed to scoliosis. And I said, oh, a family member with scoliosis, when it bit me happen. So or spine, no, it doesn't, in your one portion pen, it go through arthritis, you know, all of it into the happiness or spine started to curve. And remember that McCann said, so uti NC or hip, and also pelvis is swap. And you're good because a hanum no, so we're sharing from side and now ni t in the pelvis so, but we're sharing from the side and now only say because of scoliosis and any power in oba officer oh me chi me ya me tenase ana pain ne ko, but me sorry na say me walk oh na pain ni too much now for say me tenase bio because the body need to mean support, the spine need to mean support because of all the curves and all. And so we are very, very unfortunate now where it happened and it very big surgery. And it's for so muba hospital I say no machite and a disease way no and yes oh arthritis qua say oh yeah young person that's a unya scoliosis a very, very bad because oh now we only young person our spine our curve I won't even walk straight and you know into a messy up a lifestyle into a nice questions so far before I keep moving. I loaded a lot of information into a question before I may move on to the next a segment.
Doctor, yeah, questions not doors of pa. Okay. I hear with me distracted. Yeah, you know, okay.
I got you. Okay. So next, young cat symptoms that it would be what spinal degeneration or benya. Usual symptoms and this may simplify as any being you know but say obenya neck pain. They'll say, oh me me use a computer for 5 minutes. Now for me me ya and other me to me head into me in lay on my neck anymore just me cut down. Baby saw happen also or getting it checked out. And I said, so oh sorry, and I said, oh walk up. Now unya a lot of back pain now. It also get evaluated. Now pain about arm or no. And yes, unya pain, oh me will pain on my wrist into a through spine. No. Once I show you a picture now, it show baby our nerves in travel no. Into so pain no. A travel through neck, a cut nerve, baby, a nerve and a supply, and a pain echo. Into me patients go on one back. I say, oh, me pain and travel free me it one more pain on my neck. Not travel now come me thumb me sawe. And no one it giving me pain. So can we be such a me? Oh, I know me junior said a bay nerve pain through neck. And I said, oh, pain no travel about me fingers me and some way mono. Then I know say be through neck. And I said pain ne bahanum say. But and yet neck pain in quantity, neck issues in quantity because of our pain. You go no ma your shoulder, and I said or elbow, and I said arthritis or wrist. And baby, you know, so when you saw symptoms where don't stop getting it evaluated because you never know you're wrong. Says it's once me show me picture now, nipa no neck very bad, you know. Says nipa no sa problem earlier, obeti me I get this surgery, send a on the spinal cord and be free. But says nipa no kote baby, and I said, oh walk on any shit a wall be more and I be sign out, no jerking the neck now or hitting the spinal cord or bitch me I paralyzed. Into so some symptoms where you also will get in it checked out. And a binum so on munya numbness and not tingling or to one of say ninsa as an insa air follow asleep. And I said arm air follow asleep. Unya symptoms and also getting it checked out. A binum also a wound to me walk up. So my spine they get it compressed and I said the spine they get it pressed out. Omu walk out so my say. Because signal now if feel brain call leg fast spine I call legs anybody our leg be move no signal need to mean koye because BB press so spinal cord and also all nerves into yes sir now if you to me and walk here and I want to me walk here so I bet me a tiashe o share now feel o hit to head a be more problems. Next the near a trouble using hands. My patient do move catch on and say, oh, me button me shirt. Oh, before let me sign me check. After me sign it. And I say, oh, me write it. Say, but me be before phobia. But oh man, the pen now cause on trial. Say, me hold do pen because then someone intrinsic muscles and kitten won't in seminal and yeah, Juma because nerve will be a pinch a nerve and a get a pinch into mean you see some muscles and then yeah and write it. The worst symptoms are, and I never wish this on anyone because way a emergency. So we'll start any of these symptoms also call friend 911 right away. Okay, because or spine say BB press or spine that's a mau issue. The longer now be waiting issue ni be cause no. The less likely say so we'll fix this issue now. The function ni be return. And he said stories are if you want you know me who patients were ER or more kind of say oh. A bed 3 days ago, me lose urine. I said, me walk one, me drink so good, me home. Now me drink me guys oh and yes and then continue to live the life. Now for 2 days later, oh, my near go me home. That's a problem because I coughed for 3 days. Meaning said, not problem be a whole way before. And after a catch or say, hey, BB, you're wrong. You also getting me checked out. And I waited too longer. After you fix the problem, no cross our symptoms won't go away. Into so you nipa won't control bladder now or bowels are very, very bad, right? Because won't call outside. Or call outside we are scared say ube lose stool and also be lose a Johnson. So something emergency also call hospital get it checked out. Saying be say BB or heart you beat me ayamawa. And I think so. Next thing he says, oh, say, who wake up now to me you so on sa for 911. And I don't to me move like a for 911. There's no reason say, Obedrin say, oh, me da so. And I think me train for 10 hours, a be back and I be better. No, something you're wrong. Into now on untimi move on nine and I say untimi move on sano. It happened for 911 neko ear. The worst thing ever happened, the best thing that can happen is say 911 emergency they'll call ER. Okay? They'll call ER and I said untimi na say woman find the reason be a good news. No one call fear. But so you're unlucky. Now say one caught ER. Now say you're wrong or you're very bad. Now say when who much later then it becoming a bigger, much bigger issue. Into America says so when you saw symptoms when you be there's no question. 911 me movement 911 me controlling my bowel and I'm me controlling my bladder. ER, get checked out. Okay. So lastly, before I'm finished, a nema for a bit me also spine symptoms now me can say and yet arthritis and quite be cause so man. Say okoteshe na say osteoporosis na so unya spine fracture a bit me cause some symptoms in your me can on the way here in ipe an spine a fracture wa hanom say we say start fracture when your friend unstable fracture oba or say you're in a surgery. Next thing a bit happen is that between your tumor, it will brain and also spine. Into so when you have symptoms where you no answer what share home because what they say your tumor in the spine and a kete. So you want near taking it out, but so we train not so one getting it checked out. Tumor it grow into a big. By the time sometimes patients go on by the time we go to hospital, need too late. Because tumor not grow too much. Into America said, so when you have symptoms, well, yeah, get it checked out. There's no cost. So we'll get it checked out. The only thing I'll be honest says, if be being wrong with you, peace of mind, say, hey, me check it, we'll man find the baby. Where your brain tumor. Into we say, no, so ujaya enko. The next thing you know, unya seizures or pass out, untimi talk, untimi move unsa, untimi. There's so many things that can happen depending on baby a tumor. Next thing, infection. I bet me happen on spine. On the way say or infection, what we call epidural abscess. So on the or pimple na popua. A white stuff pus, not a free pimple no ebano. Same thing that happened with baby abinya infection be so infection it was spine now it release bacteria ni release in a omu waste. So waste in the build up and then pus no. Not personal spinal cord. I'll tell you many stories of this. And unfortunately, where it happened are very young people and it happened one because only IV drug users. And I said, omu HIV, immune system when you're too good. Into omu infection, I was infection I travel omu spine. And I can count so many people, 32, 25, omu ba paralyzed, omu timi move omu leg. Now for okwa, really cause spine, will pop into it. I want to pass. No, I say a free spine into this can also be something going on in your spine to cause you these symptoms. Next thing, one other thing to mention. So, more diabetes, a very high risk for this as well, because diabetics, omuntimi controlling infections. Into omuntimi controlling infections are itimi spread almost spine. And aside from IV drug users, omunya spine infection here, more diabetes. And last category more sepsis. Just as extreme style you can't a sepsis will treat. Your friends say as a mojafi infection a mojanim a travel or spine. Next thing you bet me happen here, omu take blood thinners, so more a atrial fibrillation, AFib, and I say any a heart palpitations are ones that you do muto in robia thinning omu blood, so na be omu stroke. Into sankofono, omu at risk for epidural, your friends hematoma, which means bleeding our spine. So all papo vessel ones that it bleed, not blood and not compressor spinal cord. Now more issues. This can also be caused by many other things, but I don't want to get into it. And the last thing, there are many other stuff, but one of the other things that young females, you will be a friend of MS, multiple sclerosis, and in lesser aggressive version, transverse myelitis. Once a young female about say, oh, last week, namin to me in Freeman right eye, but a coy within 2 hours. Oh, this week, men sa a week, a 2 days ago, min to me move my leg. Oba a spine imaging in the friend of MS, multiple sclerosis, a treatable, a horrible disease, but there are many people who get a treatment who level without any issues. And this is something I say, bet me a treaty. And symptoms where unless unya emergent symptoms now me can before now, call primary care doctor. Okay, some of them actually very good at physical exams. When we have physical exams, they're wrong. Now for may give you better direction. And imaging studies are usually a MRI. That's the best. MRI show will be. I don't say MRIs I'm showing in this presentation. Nina show baby compression or now baby our spine a pressed. X-ray helpful, but MRI so far superior. Inti with me I get the MRI, fight it to get the MRI because I know they become more information. Inti you talk about some treatments in my patients. So patients about my clinic what do I do? And yes, I'll buy and I'm your fun surgery. In fact, most people know I tell them say I won't do surgery until say you cannot live your life because of spine disease, okay? Because me catch say spine a long, a continuous. Into move spine and move together. So we say our spine move together. Baby move together. So we surgery one part. Now it me changes that movement and say movement need change more problems later. And before I be spine surgery, it was we absolutely sure said I need this surgery because me live on my life. And I mean to me juma. And I say me me ma enye she me them me and say me take couch muna me hear TV. That I'll say we here also we'll get some treatment for it. And most patients here who first treatment I recommend a physical therapy because the mechanic said spine is supported by so many muscles. And sometimes don't get this our muscles stronger. It me get rid of pain. Internet exercise you're very good. Me if you want me to me say me back SRT AM and I say BB start TM. That sometimes tells me say I need to strengthen my body somehow. Now I call some exercise, me yet some ab workouts to help strengthen my back, a little bit of back workouts, physical therapy are very important. Now, omu a lot of pain omu back. Omu timi participate to physical therapy. The next thing I recommend is aquatic therapy. Some people omu ko pool, omu ko pool mo because pool no lift it up all the pressure our body at the good spine so they get it relieved. And some people omu timi swim yes omu physical therapy what pool so that pain in you too bad prevent you from exercising. And swimming and so a very good exercise to do. Next thing chiropractor. Now this chiropractors me issues with them because sometimes if chiropractors be omu pesika Inti omu say, oh, bra, every week, or also about twice a week. That's not the way, okay? And sometimes treatment that may not be even the appropriate treatment. So, chiropractor, also especially with how much money you're paying, and say, oh, not say, or symptoms and yet better, you need to do something else because always sicker. Massage therapy is something I really like because massage your muscles, body more feeling good, and it relieves some of the inflammation and stress that your muscles go through. Into massage therapy, I'll recommend for everyone. The next level before even thinking about surgery is spinal injections. So bad now pain now your mouth physical therapy and now pain in yet better. Now your mouth a prescription to go see to get a spinal injection. This, the American terms do not ever get spinal injections in the clinic, in the office, okay? Spinal injections should be done by a pain specialist, pain management doctor. Also injection. And I think so injection now, you have to make sure that they're using X-ray, okay? Because injection targeted. A nerve being a mouth issue. Into some nerve no will targeted. Into say obi in the office or in a blind on used to X-ray. They may not get to that target no. Into symptoms no. Any better. Into some people say, oh, my injection or clinic, it didn't help. And then ubi so almost say, hey, use a X-ray, almost there be. That means say baby inject in and you now problem no. Into that you need to see a pain specialist. I will use X-ray to find nerve and your issue no inject this nerve in the mouth. So prevention is key, and when you talk about prevention, you also talk about risk factors. Before, like I said, arthritis is a part of aging, meaning that as you age, or spine be aging, and I'll be arthritis and the causal pain. Into some arthritis is normal. You be some back pain at some point, okay? But your back pain, it surgery. Exercise, okay? Strengthen abdominal muscles, strengthen your back and neck muscles. I'm a strong believer in exercise, okay? Not body lifting, exercise, controlled exercise will help not just your spine, but exercise can help you in so many other ways. Depression, anxiety, stress levels, every exercise between me, deciding my way, but down. Weight loss or spine. And so obi more or joining sentence the bones grow. Your bones don't grow. Or bones deep 25 and I be or bone stay the same in change bio. Until we kese sana or bones now will put stress on. Into bones in the knee ne hip ne spine ne chi because too much weight. Into exercise be help weight loss. Into everyone, I recommend losing some weight. So you're overweight, I be help so back pain. And I feel prolonged sitting. So it's you need maybe or say a year juma every hour or so. No, so sorry. Now we'll move around. Now stretch your back because see me back instead say bend nice curve no a bendy say. Into me try for too long, I may put a unnecessary stress on my back. It also me move, so me put my spine back in the normal a alignment. So a bed function yeah. Next thing diabetes. On say or nerves in before our nerves be we hear blood. Diabetes stop a disruptive blood flow. Into so disruptive blood flow, and I say so blood flow to our nerves and yet papa. That means our nerves in here juma. Into here if you want diabetics be on once we feel night into so or walk no step in glass a crana on feeling now when you're ulcer. Internal diabetics be omunya foot ulcer na say if one my diabetes affect your munsa or no aduane abunsa sheshe nse nyina because feel it. And you're good. Getting diabetes under control also a help or nerves help. The other thing is that diabetics have high risk for inflammation. Into even little bit of arthritis in the spine now and causal pain. No, so diabetes ebema pain not get it worse. Because only a high risk for inflammation. See, diabetes control is very good. And after next and there, say, we need pebia or ujina ha once wa bendu a chi and also ujina ha funny way bia, and you're good. Okay, because who put stress on your spine for no reason. Everyone also standing upright now or posture no maintaining neutral. So that was spine it stay in neutral because we say me obianya exercise test ujina hona say me ma bendu o con say for 10 minutes see how your spine feels. Indeed, so we put a stress on your spine because of bad posture and you're good. And last thing there, lifting heavy objects. So for us the young people bodybuilding, there's no need to lift so much weight. Only bad thing if we want to put extra stress on your joints for no reason. Okay, and occupation, nurses move patients all the time. Move patients. Also because nurses will buy your clinic. One time let me move patient and me feel it pop. I want me back. And since then, because nursing now sharing chi and use proper technique. And so a very important say move patients and medical assistants and patient care associates also is something very important over here. And lastly, construction workers, heavy lifting. Very high risk for spinal issues. So to finish this, I'm going to go through some cases recently in the last week and a half or so, 2 weeks, cases on my some of these patients you treat you. So a 35-year-old male or by a clinic or pain on the neck and in the left arm. And so my disc and a presses spinal cord, and I shall disc in a spill it way your left side now way your right side. Disc in a spill it call left side and hit the nerve now if hanum. And I face so the spinal cord, it was a city hanum. But disc and push you spinal cord a cause side hanum. We say one shiny symptoms and nothing so will develop a weakness over time. What we did is you try some physical therapy, chiropractic therapy, and the symptoms not get it better. And after it didn't call surgery, it could a disc in the free honum, send a nerve and then get it pressed anymore. And so you disc in the free honum and the cage because you have bone never rub against the bone. Where you're feeling fusion, fusion because it fuses our bones way together. And patient surgery next day or feel good. And this one old guy when I am can say old people when you saw bad a compression one neck old age and I will buy a severe neck pain and a weakness on the arms and I feel intimate walk up. And to hear the spine now, disc arthritis and the knee hitting the spinal cord. And I also white and the one spinal cord. That is inflammation on the spinal cord because the spinal cord near angry because BB press it. Into side line way, a cut way, who's a spinal cord near free. But say me cause cut, I walk baby a disc in the one there's spinal cord in your free bill. It's being pressed really hard. So we'll compare it difference now. Spinal cord fluid around it, free, happy. But of course, our level where spinal cord in your free bill. Until this is someone you take it to surgery and you remove side disc, and you fuse you way. And he did okay, but we'll rehab. We're a 25-year-old female or bi with back pain and then leg pain. So this is what I was saying. Or 25 years old, and the disc, all of them, you're almost healthy, except for weight, and you're healthy. Disc and a bahano. But the only person me point out near where you ubona u feeli wo chino. So me the men start to me cheese say let me feeli bona me timi feeli. But we say no. O connect here won't me feeli because the fat I want to chino be say. Because you're very, very overweight. When you are fat, I a gunechi. Say, shit, we have no fat a gunechi in any white when you are fat. Into any power, I will never do surgery on them because 25 years old, this is not the age to get surgery. Into the only thing you're recommending is that watch your diet, lose some weight. The pain will be better. There's no need to 25-year-old to be going through surgery, especially when you're so overweight and your symptoms can potentially get better with just losing weight. We're a 65-year-old lady. Last week in Amihono, or by hospital or a disc, I press a nerve, or known to me moving a leg. Or foot drop in the leg onto me bringing it up say into the nickel surgery and you remove disc next day after surgery in the leg now you very good strength and no cold fear. I think 2 days after surgery or cold fear. Where your case actually Wednesday. This is 62-year-old or yeah, surgery. I think it's about 2-3 years ago. It was Hanum, and after a next level, a break it down. Once a disc way, hit his spine, a nerves for Hanum abano, and a nerves in kinked into a core a surgery na you remove disc, and after you remove bone where and you screws and the rods and you keep your spine stable. And surgery in 55-year-old onset multiple disc herniations onto spinal cord pressed. I know, so you take a weight surgery. Your friends Wednesday as well. It was this surgery. And then, this surgery, and I'm a way say same day. Way a 55-year-old or by on say disc way or no arthritis or back it presses spinal cord into the nickel surgery. And because I knew them, me give a lecture and I'm saying, me taking pictures, me real fake, I say me taking pictures for a surgery. On say nitiwa hano, nitiwa ha, anafe ne chini, ana we ne kon echi honum no. Into your coin and you remove bone and watch honum no. On the bone, I will feel it back hanum no. In ye, sa bone in ye, ana a hanum no na press a pressure in our. Into you remove bone ni free honum no spinal cord in here. And a spinal cord now you free. But because you remove bones in free honum no, also you put your screws. Send a spine in move in you say. Into you put your screws and a rod a share homano. Into this is how it looks. Into you remove bone there where hanging send a spinal cord no it be no room to breathe. And that is it for me. And this is my beautiful family. Thank you.
Oh.
Thank you.
And I was Dr. Justice Agyei. And the share of the Amayene. And the short DVP, you said no surgery is about 9 years, right?
7 years.
7 years. Now all day just few minutes about top for Amaye. Now means now it was CP. Now remember, you do sooner yasembisa. Now me say a doctor for P were lie so. Mammy acknowledge you or money we are first bisa nemra. Me say Dr. Thompson so. It in Tuesday, Dr. Swami Usu Frimpong was so. Dr. Patricia Baby also. When you know the mass say more than dear but tired me Nami and Sram. And yeah, my first question, first question, in kind if we chat me by, but in kind the first. Hey, we are my pajamas, no more my pajamas, but my best friend. Big question we say, would you epidural, Michelle be or bar, I be or now what epidural, it's me a caution, no chronic back pain, and if I saw no patch in the question.
Yes. So the simple answer to that is ASA. A bit yes, a bit to me. Okay. But and yet in nipa umubenya epidurals in the benya back pain. Because they are small needle no mu de koechi. If you know more onoma omunya back pain na enye from epidural no. Pregnancy ninyina no e cause stress or back. Most pregnant women complaining back pain. And after hip and it's up pelvis it expanded for the baby, into some a natural expansion and it stress of the belly, Nina cause of back pain. Said omunya epidural, no, not say after delivery, almost say, oh, epidural and mommy back pain. A lot of times that's not the reason because epidural needle I koechi. And near mommy kai say a disc arthritis and it's an meninino. Yinina ye benyabi. Ain't so nya epidural no. That's 2 years later, onya back pain and ya epidural.
Yeah, Dr. Edawase. Then patron me friend Mr. KTS. Now it was same bisanaba. We are let me say mpaja boro so kata now on swaba.
Yo, may I say, Doc, I'm say young Ghana for I say pain, idea you go through a lot. Now, one thing I'm person be say sometimes you go through pain now that from no be a TTI so. Now wait me I feel a bit okay. A advisor will say BSA and I say yes no in other words no some different side effects.
I truthfully, me kwa me yebi. Just make sure say anybody you too heavy. You're too heavy. The thing they say oh pain also who reason into our pain. Say any man me kind, let's say it's a fracture or cheek. Who names a fracture or now so obi ko jinajina we chia omu betimi amana ye worse enti ameka say also at least o get some evaluation say why na me what pain way me a surgeon and I see patients all the time and I'm in scanning me on my back but because way I mean who pain I can tell what kind of pain it is and what is causing the pain enti even that no me are very scared. I don't think there's an issue, but so pain you too much. Now say go to that point so here Emma obi enye bibi mouse and be a pain be go away. And he also getting it checked out and be a who say enye bibi bad na cause
Doctor, I'm follow up question. It's not yet, is it a kind of massage, be as a massage therapy, be sana?
It's a combination of both. So muscles and I will press it. But the onset I was like crack. Was it all crack it? I said or crack it or fingers and a joint. On the joints now I'm show you what chihonum. And no name move where air cracking. Is that good? I don't know. It depends on the person. But it's just because we're not for too long. Me surgery for days I may surgery for 10 hours, 15 hours. Then me surgery all day. Me coffee and it was like I need to lay down because my back. Into and yet Satan my castle will be because there's a reason. Just relax. Because I think that ujina feel better. It's because move joint kakra. Now it relieve some pressure for you. I don't think it say a bit me a causal problems, but I think so. Too much pain and causal issues are all the time will be beginning our chair. Also getting it checked out before our big progress.
Dr. Edward Sepa, I mean, opening Diabo.
Okay. And also, that's the doctors, Edward Sepa. Me question ini. Nanka a linky Katie at the end, Kakrafa, a mimi, but se me finance and so sa. Da, ba who ha me Dr. Bateman Basse, Ubi or na wechino wonni pain bia won feel pain bia wechi se e bia mechie me ya but yen Ghana fui ayaya de ba ko pa kese ne yekotudwe timi maye problem pa enti betma ba se wonni problem bia wechi wonum se wechi de all right ukotudwe no so no eno no eya na ifri hin na eba ene o disk ne wo connection binti ene ma no kofa sa yare ne ba na se eno so ye separate bibi na ema sa yare ne ba me do wase.
Very, 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 very good question. So, and I'll answer. I will answer using several anecdotes via Menhua Clinic. Okay, so Ibonuma. Sometimes a very separate issue. Let me share my screen. Muhumi screen now say muhu.
Inyahuni.
Okay. My main sharing my screen in bio. Na min chow baby. So share baby our nerves at travel lot. Nerve be or sorry. On said nerve way say no. L4 no. A travel fa wuni. And a call hano. Enti bon ma inya patient or say, oh me chia me ya na pain no family. Musa mami ni ye me ya pa na fe a come foot. Enti se me tisa story na. First thing I'm doing say, hey, beat me on your spine. But the pain ne wo wuni nkwa. Na say shooting ko baby for be and I say and starting feel a chia. Sometimes ne ebi ye ni nkwa issue now arthritis. Okay, because o joints e wo body mu nyina undergo arthritis as you age. And I Ghana for you do yourself any favors. You carry niema or you tiso. And I think so. Very true. And I think so. A lot of, especially Ghanaian females are overweight, and so those people know the big problems. Omu nyaye, omu hip, and omu knee, and omu ya. And sometimes there's a connection, and the connection is say oh knee pain na, on walk normal. Because on knee ya into walk most uche say say into yes na feel change your alignment our spine while I will walk on into over time on knee pain no ebitimi a cause arthritis ewo wachi. Into some beginning most of the time they separate issues. Into so what pain ye unin kwa. Now say every now and then almost in swabe show knee most knee aye kakraka. They also get your knee fixed because that pain in through your spine. But one get your knee fixed that it beats me a cause of back issues, spine issues.
Dr. Elwasi, when you said Dr. answer a question, come on. And then it's a chat him next question. Dr. B was say, you say in your money, it moved a high hill. The high hill, we talk cause effect almost spine more.
So that I'm gonna tell you frankly, I haven't done any studies to study that. So I can't with 100% certainty tell you that it causes a spine issues. What I can tell you is that it changes your body dynamics. Because it changes the way what cheek rise and it changes the way I stand. And so over time, what's your high heels are? Can it cause spine issues? Potentially, maybe. The big issue I see with heels are your foot issues. Once the toes in the air curve in. Because all the time, utsi ball of the foot, and so say, until over time, no, that no bit me out my issues. And just know, say, any issues are what leg mono. A bit me a translate ya kowachi. Because issues now all limpo, that's on walk straight, and that's on ye be a favor one leg over the other. That means our spine a move as one unit. Into between our causal issues, but I don't know any direct link between heels and spine. But I know heels cause bunions and a lot of foot issues, and so and that over time can cause spine issues.
All right, Dr. Edwasipi, and I'm afraid SA. I do a question Abba.
Yo, may I say, Dr. Mpacho, the question is say, and now bow-legged. I have my name is I'm a friend again. I can say bow-legged.
Bow-legged, yeah.
Ayo, sa and I know yare. And the entire maybe sa say, Madam should be only be about 59-60. Oh, ya bow-legged. Necessary, I make a say. On to me, she, and nine, when you arthritis, when you near my baby, on to me, she. Ain't maybe says a question, no. I feel question anymore, me bisa say, Sebio, who or ya bolega, and Tampana was say, who cocoya be for one, because 60 years as you say, on to me, she, you know, I am in one kakra, which much mukakra, made us.
So, I'll start with a crown. So, bow-leggedness happen because of many issues. Sometimes a family, okay, a running family. Sometimes it's because it just happens. There will be any reason behind. Other times, and it happens because of vitamin deficiencies craninia while all growing up, like rickets, vitamin D deficiency, and I said some of the minerals over here or body mono. So when you're at an early age, it causes all legs not bowy, now you're bow-legged. Now the thing with bow-leggedness on set, so shit like a nipa way or walk the night and then the cheek and everything move straight. A bow-legged person, a leg and I say, into the knee, no, and a leg, a thigh, and a leg, a move, it be a movement and then you're the best. And I feel so movement from thigh, a leg, and the ankle, no, also ain't the best because everything I hear curved. Ain't say BBA in move right no, it lead you to arthritis fast. Ain't you know what down for also is 60 because we're living the life all throughout using those legs. Until over time or no, they can get arthritis. Depending on a nema on so for a juma and then so left in nema baby so no yet in her 20s no yet exercise too much and I said you know it's only many factors I bet me play a role but so when you are crowd what bow-legged that unless say a causal hip issues and I said a credit to me walk what most of the time I don't think so we have surgery be out for that. But say your vitamin deficiency, it needs to be recognized early. Send will be bet me I'll fix it.
And in patch or when you need to see how to manage you before what's my and
it depends on a reasoning untimin walker. So untimin walker because of arthritis that won't knee. Any orthopedic surgeons need to me a knee surgery a man. And I said a hip orthopedic surgeon bet me a hip surgery a man. But you know, if I don't fully understand why untimin walker. And I wouldn't even reason to untimin walker.
There be minimum reason reason I can't say the 9 no and a no point no say. And collaborate just says, oh, yeah, Bolegano, one, yeah, Yamano, and just all the union to say, I be anyone bet me, I am man. It just says, so back at them was, let me see, hey. So let me be says,
Sure. I think that
a second opinion, be
the major and said, if I was to guess, I would think that because of arthritis that happened in her hip and knees probably you know what I mean but I don't think that and I haven't seen this surgery for bow-leggedness. I have not seen it unless independent to me walk up and I say it causes hip issues.
Okay. Yeah,
doctor with the bow-legged the main fact may minim jeka crabby was say emwa. Oh, number what I saw say orthopedic surgeons no more yen say be a pro bow-legged no confrontation no ebi what ma na usha obitimi share no a POP na for some time say be betimi aboa with strengthen the you know the 9 no na as na you know omoyi but as to come here the minim there omoye it say akwabi so will be I think say better say be a obi hunu orthopedic surgeon na omahwe so mutimi aboa na nti yeah ebeko chat so the doctor na obi usa question bi ohonum o say wo too much information ewo body ma there na obeye me had answer the question as you know what you say pa dia
no mentias and come bezeni pa na obi sa question explaining it more because too much inflammation I don't mentias
yeah now I mentias it in a message Mary na obusa sa question no the me ma kwan na ko mute ho na wa kire mu ye na ya te ase so also there.
Okay, so go how cause doctor when you pain be na hospital be I was say oh too much inflammation tine or be our mouth diclofenac onuma eno etimi echo tina me bisa san
a hepa no muka as inflammation in what
body system no.
Okay. That's a tough question. And I guess DNA symptoms being not all.
To be a pain, be a knee pain, and I say.
Okay.
Yeah.
Okay, so pain will knee and I say or ankle and I be bisa. Okay.
Yeah.
And no, and yes, inflammation throughout the whole body. I think that because say BB possible with knee and inflammation. Most commonly, their causes are pain, a arthritis. say we will be our arthritis or knee and I be beside one say a cause pain once or knee hono and this animal and sa pain no ibuprofen this animal help
Okay.
but I don't know says inflammation in throughout our whole body. I think that a localized will be an issue no one.
Okay. Thank you.
No problem.
And yeah, my friend Mr. Bell now Abaso.
Hi, doctor. My name is Sheena. I also want to be a doctor like you. I have a question. As kids, what are some things we should do to protect our spine?
What's your name again?
Tina.
Tina. Nice to meet you, Tina.
Tina.
Pina, right?
Sheena.
Oh, Sheena. Awesome. Sheena. Great. Being a doctor is awesome. Okay. And I hope you become a neurosurgeon too. We could be partners one day. As a kid, what can you do to protect your spine? Okay. One is to avoid too much horseplay. Do you know what I mean? Horseplay, climbing things, jumping from the top of things that can cause you to fall and hurt your spine. The next is to try to be as active as you can be, okay? Exercise, but don't overdo it. But for you, the main thing is to not fall off any high ledge to cause a fracture.
Thank you, doctor.
Mm-hmm.
Dr. Nate, you have chat and so we are my friend next person and now also the question is not about. A bit type I don't know, say their contribution, you know, or maybe as a question so they are by high heels and so they are or say high heels increases risks for varicose vein. So Ubusa also contribute to, I don't really know. All right, and the next question also, is it good practice to carry heavy loads on your hands all the time when you are walking?
I would say no. Okay, it's not good to carry heavy loads anywhere all the time. So especially in females, the big thing is wearing a bag that is very heavy on one shoulder. And some females so omu walk na so show ma and I say men no more bag once omu their shoulders on. Omu walk na so show ma from a chair once omu tell to say no more walk. And anything I bet cause so to change your body's dynamic walk on and you're good. Okay, because what will happen is that who put too extra stress on your back. And I will tell you a story. So when I started residency, I was feeling very important. Into fancy bag out the very nice bag. Me very happy. And I made my laptop and then my lunch. Every day and I'm decorating. Within 7 months, now I'm starting your hip pain. A pain will my chin in my hip. And I was trying to figure out what is wrong. And one day, now my new be kasa. And I'm a bag and then she me corner me jina honey ni pan kasa for 25 minutes. And then me who said, I mean to me jina hobio. Was that me take it bag and off because now me pain in bar so badly. And me who said, oh, this is what's killing my back. Into a few honum no book bag and after meshe. Me cut job interview crowd book bag na meshe. Me mfaho. and it wasn't until then this who said other doctors, older people, no, book bag. A lot of them should book bag, and I know said because said it give them the best alignment while on walk because pressure need evenly displayed on your whole body, and yet baby obey say send walk. I said oh carrying so all the time, or fetch water bucket more all the time. So hold this bucket no walk 1 mile every day. I guarantee you in 2 years you're gonna have hip issues and our back issues.
Okay, the WCP. And my friend Ama Homeda. Now all me to another question on Abba. Homeda, ona Homedaba. Okay. It didn't Homedaba.
Oh, but that's it. Michael.
Oh, Michael.
Yeah. Me, the Canada doctors, in fact, what they call a very detailed neurosurgeon class. Things say you could take in the school and give it to you over thousands to attend that class. And dog get that's why I'm sure for this short time my presentation. Make 2 quick questions. One year, say Adventist, since usually we talk about diets. In your specifically, who dear amount more a degenerative into, and I say lead you more into arthritis. And the other part is in your also more a boy is easy from getting arthritis. And I'm asking this because my presentation will be because with the fresh tomatoes are more arthritis, which I don't know anything about. Until in doctor's course now, we read when your presentation, when your papers gear. Support diets and arthritis and a second part here, more family history of arthritis now. And no, is there any way we bet me to be a younger person in that family? Bet me prevent yourself from getting into arthritis, not about fracture and other stuff, but so also be arthritis. Is there any way I bet me prevent arthritis and these are the 2 quick questions.
So let me answer our second question first, because I know you're easier to answer. Yes, so all family history of arthritis are to me. The thing is that remember, arthritis is a part of aging. So every single person it being arthritis as they get older. Some people get it worse than others because of it can be many reasons, family history, or causal arthritis. So as a person, we're young and I will grow, things are between me, things are listed, men lift over heavy loads. Who keep a good posture. Won't tenacity for too long. So what tenacity I'll be sorry I move every 2 hours and every 1 hour to 2 hours. I'll be sorry I move. And I think so. Yet too much exercise it puts you stress on your joints. So, and I'll give you an example. Obia or sorry or running or go outside or running 5-6 miles every, or let's say 3 times a week, in their 60s, they're gonna have a lot of arthritis in their knees, their hip, their back, their ankles, you name it. Okay, it's gonna happen because we use any joint too much over time, and we abuse our joint and not. The joint will pay you back at some point. And see, the other thing now beats me is that there is a lot of data supporting, the inflammation. We talked about inflammation in the body and how to decrease it. Unfortunately, that's not my specialty, so I can't tell you anything with a lot of data behind it. But I do know that there are some foods increase it. If you're gonna get inflammation somewhere, there are foods that increase inflammation versus others. So, and we talk about antioxidants and all that stuff. It's gone. It went one way and then it went the other way. First, it was very good for you, and then it went that too much of it is actually bad for you. Okay. What I would tell you is there's no specific diet to treat. I don't believe in diets. I think eating healthy, meaning this is something I was taught back in Ghana when I was a kid. Eating a balanced diet is the key. Balanced diet has carbohydrates, it has protein, it has vegetables, it has oils, which are good, okay? And what else? You can have fruits in there. If you eat a well-balanced diet, I think your inflammatory markers can definitely go down. But I don't know specific details, especially with tomatoes and all that. I would tell you that tomatoes are good for you because it has a lot of antioxidants, okay? And in fact, will actually decrease inflammation. Whoever says otherwise, I don't know because I don't know the data behind it, so I can't say. But I know that eating a healthy diet can help prevent arthritis.
Thank you.
Mm-hmm.
Question?
Doctor, I just have a comment.
Me too.
Oh, Baucho Van me me to me. I'm because a better chat so we are now a bit together. Any part my friend our basso the question so no Abba. Now obi a busa say is there any relationship between big stomach and back pain? To be any one in the full eye casino. Beat me I'm on back pain now.
Very, 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 very big relationship. Very, very, very big relationship. And the example I can give you is say your mama no. So munyini na so no for yekese bonzo ma starting your back pain because there happen is weight it was so me move your spine forward. Now for all the time no which or muscles na which it work it to bring you upright because weight na what front need too much. And I work it say send be able to mean the spine about back. Into some muscles na juma all the time send be bring go back and it get it fatigued. It get it fatigued and now a joint in a weak and only lead it to back pain. Into say big stomach that means you're overweight. That means you gotta lose some weight. Into this is someone I would tell you says I mean your back surgery no matter what you're gonna have pain because the cause of the symptoms won't get rid of it. Into known also will address it first. Also find out why everything also what will be say it didn't in a way into why na me kese. Is it because me dear moon too much? Cut him on. You're very true. This is so me mommy a very delicious jollof. Me mommy the jollof you're the best compared to everyone, every Ghanaian. Or you're the best. The chicken stew you're the best. Okay. Every time me mommy mommy na me the bad buffalo. Me dear for 1 week my weight increase by like 5 pounds. Because Ghana your diet is heavy in carbohydrate. Offer more 3 cups. Not a bomuke to be out so now the number going change. And on your balanced diet. And team said you and me every day. Yes, my food bakers. And also or diet and who dear who do for all the time and so you're good for you. Also eat some vegetables, also eat some a little bit of carbohydrate, there's some protein I can't so a full year can say also be someone who say didn't tell me a full year can say now or fixes our problem because I know between and cause a lot of back pain.
Dr. Edwasipi, and my friend Mami Christina. Pacho omutu hona bra Christina. Say on your ready my friend. Okay, Pacho Kasa.
Ready.
Yo, atokata.
But oh, me den degenerate. Na me tishy wo store. Me tip him hosa. Into no nature be 3-4 months time. Na car some bore me for.
Oh,
I'm sorry.
The sisi nechi ho me left side no. That is my friend in lower back. Ama me ko pain we or more year therapies, but it's still a pain we too much. It mean you know be 10 to 15 minutes square. And I mean to be so and fine and tenacity. Tenones are no me the impact.
Pain no. And I'm very sorry, sir, we'll go through this. That's very, very unlucky. Very, very unlucky. Pain there cold name.
Impacho debi.
You're just in your back, left
Yeah.
side.
Aye. Na mechi ankasa so ye me ya me mu ono. Aha, me sisi ho ne de no nko. E na mechi no so me about me mechi ne nya me akese te say me sisi ho ne de no.
Okay. Anna, a pain no, a yet worse. So o bend there and I say o stand it.
That is me gina ho a me ya. Me transit me ya. Me ko bia na asem say kra.
Okay. Anna, your friend is saying, again, I'm a pain here better.
So funny they meet me because me that many kura me ya. It mean just say bit me apoa me no tin e ma me bi no.
Okay. Last question. Pain started after car accident and car ball.
Me tehwe no. Na me ya but na nya that much.
Okay.
Car ball me no and e be worse.
Now, when you're imaging back, my X-ray, CT, MRI, anything like that.
But almost MRI.
Okay, and then it show here.
Almost say me hono say almost can be beside a clack you say be beside.
Okay. And a therapy ben a why?
If I tell therapy, me gusukra me we na. It's like almost way no more the tally hono. Na shoko kitty bino. I feel almost the be a heat towel, be sanom de ataro, but almost it didn't happen October. Me that's so me who any improvement be a.
Okay. And a job ben I want
Almost mammy Ruby when coding phone Ruby na that you know no my volunteer and I'm in town.
Got it. Now who take your ibuprofen be an answer visa?
Ibuprofen no time I'm and I'm taking kakra, but nay too much because the train no na mammy to me crying used to bathroom now me cutting off.
Okay. I didn't know you use bathroom.
Na mammy nya constipation. Sana my dream say no na cost to me sir.
Ibuprofen usually end your constipation and your codeine, no? And I would guess no na cause society, you know. But we'll take your ibuprofen they help.
Not that much.
Not that much. Okay. Okay. So for you, no. I mean, me who MRI, no. I don't know what the pathology is. But the mechanism continue therapy, no. The other thing they say also all the other therapies now I'm kind of try it. Massage therapy, I like it because I think they do it very, very good. Okay. The other therapy, aquatic therapy, no, or call swimming pool. You see, so it's not pool, no matter so pain in our call because weight, everything, pressure, or body, water, need relief. Now if wait me I exercise a bit me and move or body no way a bit me a help and I won't try injections be a meboa.
Almost war me be. Say normal science schedule me. But me know because of Bruno Yard or so my system. Back home for me the almost drop almost me moja. And almost say they walk side the bona. And no me who be damn in so far next came pa. And as I say, you almost on my me pain we injection and kasa. But most of the man so me collapse. It's in a mammy true say we no more sign to say almost sense to do this. Say me
Okay. And omuye injection well so injection on your first and a moja into unya actual injection with like for pain.
If I talk all the kind warm pain medicine not twice and son almost me moja no e dia almost say no never come for my me son.
Okay. On different occasions.
The same doctor anyway, but name say different way there.
Different that way to say. Yeah,
yeah.
Okay. So when we say injections mean saying we same day.
But or there be.
Okay, got it. Okay. Wow. Okay. I'm very curious as to MRI the show. I'm curious. I mean, you can. I'm very curious. It's me. I send the album. I would take a look. Not who there. Any other recommendations? I meet me there.
Right.
Because but one who neurosurgeon. I'm not orthopedic surgeon.
Debbie.
Okay.
Orthopedic.
And no nya me sisi volunteer American Debbie no. Oh, okay. That it means sound so tamaka ne ball me no. Me right shoulder no so affected. Into the whole orthopedic or yeah. Means sano die me nya bi but sisi ni die.
Okay. So I'm curious, maybe a bit me are connected after this. So maybe I met me I share and near my mouth recommendation.
Thank you so much.
Okay.
Right. That's sure. It's about your dynamic and send the amount.
Your friend is saying how do I get
Yeah, Pacho.
Yeah, so what me information. Yeah.
Sir, in case Ubu here doctor with me getting in contact with me. And maybe I can the contact.
Yeah.
So we are so their contact in that sort of baby or the information about na Baboa on Saka doctor na on the dinkomo.
Did I say I saw about a minute name Kaka be real me home but so they ever come past the
that's okay.
It's the other Roma.
Yeah. And yeah, Pacho, my friend, I saw penny for Jensi, no vaso.
Papa, Doctor, you can get that. I'm so proud of you, Justice. They say Justice for no, yeah, Doctor probably or first Ghana, we like it. The say more boy information. They say question me pen bisa say obi o ho a I'm asem na America. My family will see a problem. Meaning say genetic baby, but yes, as I say no chronic kakra. Na meaning if there's something a bit me here beko. Other than say yeah, ebusuan mu ade no. Because
so enema bebre honoma ebusuan play a role, but I don't think say ni na a free ebusuan. So I'll give you an example, not to tell my father's a medical
Yeah.
But my papa was a lot of back problems. Okay.
Mm-hmm.
You know, in the spine, that curve was a little bit. This one was a little curve. Okay. But then yet as bad. But I know said with Yemi different because and near my papa go with through no, and you know not me go with through. Or no, or lift it heavy stuff. So heavy stuff no, or lift it. Me walk Ghana no, now me go fetch it, me go fence so. Bonze okovenzo bonze the seal console now or walk but a body bonze a dawachi into Sanya mania I think that experiences now more going through no. You're very different from the old mabe going through.
Yes.
Because environment, you know, who growing up and you're very different from all the other.
Okay.
Even though say yes, some arthritis in the family, no. You know, you kind of said in medicine, you kind of say genetics loads the gun, but you know what you do afterwards is what pulls the trigger.
Yeah.
The only way will be pull the trigger and you say or it put a stress on the joints. That you can of course stop it, but the only way I best stop and say spine I say. It's like my more diabetes. My more diabetes yes, predisposed. Me and your diabetes or risk it higher. But social journey would deny share and never be away unyebi. So just because they're running or family doesn't mean they're also unyebi. But a nema obey na a bemasa genes, you know, about out.
That's it. Thank you very much.
Wait, Dr. Patrick, you call chat name Nakamia Miss will be question Pacorda Academy. Now, sciatica, if a sciatica, ya, who has acupuncture, would recommend the acupuncture for sciatic pain.
Very good question. Once your friends, a medical school, I'm in McCoy, a allopathic medical school, meaning that it won't teach you any of the other alternative medicine methods, you know. So chiropractic, acupuncture, spiritual healing, all of those, you know, my learning too much about them. Into my opinion, I'm aware about them. It only comes from them hear from a patient. But what I can say is that anything I obey to help you avoid surgery, you're good. Okay, so oko acupuncture, that's a treat therapy. That's a pain now perfect. Okay, that's one less surgery that we have to do. It's the same with the chiropractor. Only thing I make my patients and say, so chiropractor and quantum, sometimes I have issues. So make sure so moon crackle and it's on there, man. Okay. Or more other therapies on we year for spine, you're very good. Aside from that, I think that any type of therapy aside from surgery, you know, as long as they help on you're very, very good. So yes, I would recommend acupuncture.
Okay, Doctor, I was it. I think that Ubian Pijana said, you know, yes, I record chat and should be able to question that at first, you know. Now, Ubi a bisa, no, Bella, or say or pain from the right elbow, a bad in Sano. Now, some elusive 10 bits on your tingling sensation. I say also Okona check up on her. And that's an exercise we want to me about relieving pain every one.
Okay. Or what line is so maybe let me be and say fingers being a pain they come.
And Bella message na oka o so a na o me too ho. What about my doctor to question I see?
Hello, Justice, it's Belinda.
What's up, Belinda?
Hey, yeah, so I had like surgery on my finger, like between the wrist, the wrist, there's that little hole between the wrist, like I used to like get like water over there, so I had surgery to remove that. Like I don't know what they used to call it, but it wasn't like pus, but I said maybe like hard water or something like that. But that was like a surgery I got a long time ago. But like I do get pain from my elbow to my fingers, and then like it's like, yeah, sometimes it's kind of like tingly. I get this like tingly sensation.
Which
so
finger?
Is there like my right finger, so like the pinky and the ring finger, basically.
And that's exactly why I wanted to ask you that, okay? And when you get the tingling, what are you doing?
No, like I woke up with that feeling one time. Yeah.
So you woke up with it, and now when it happens, when do you get it?
When do I get it?
Yeah. Are you using a computer when you get it? Are you using your phone when it happens?
My phone.
Okay. So that's a big issue that a lot of people are having now because of phones. Okay. And this is it's because nerve na efahanomono.
Yeah.
Sa nerve no and a control is 2 fingers away no.
Okay.
Inti say who do phone all the time like this, and I say who use computer not on sa eda board and so say all the time. That nerve no, I get it pinched. Until I get it pinched, and when you start tingling. And if you know, so oda or side they say no other one son so. Until that's so I want so not on finger and call a number and now I wake you up. Who shake it up once I call. Until a honor nerve no efahano and it causes our problem. Until the best things I bet me I say one say ube use computer, make sure say or height no. So maybe using my computer says yeah. So make sure so height no higher than or keyboard no. So you bend this out arm and it's so much. And then the other thing then say put your phone down. Okay. Put your phone down. Instagram can wait. And because this is something we do surgery for if it gets worse, okay? And I'll tell you from experience, I get it too. When I type too much, I get it. So a lot of times I dictate it just so I don't have to type because I get that same tingling. And I'm getting it right now just because I was doing all these things just now.
Yeah.
And so that's where I think that's from, okay? I don't think it's your neck. It doesn't sound like it. Yeah.
Thank you so much. I appreciate it.
Doctor, next question, this is touch kakra by behaving in pakono epe more in tremu or honum. Or say, so India na fancy organ na so na carry adhere away to no. You bit me and the effect our spine na. This all can fast kakra. Maybe pakope e munchemu pai.
Okay. I think that I see the question. Is this the one that is I have a hip problem?
No, no, I was so as a mistake. I say, is there a possibility of negative effects on people who used to carry heavy loads on growing up? I know, Eric, you want to say, I know what. As a mistake.
Okay. And this question, dear.
The hip problem in Minyaman also.
Oh, okay.
Yeah, we need the Ubusai for heavy, load, no, when going up. All my presentation, this is all can was back. We think they be the in the move view. So question that.
Oh, is there positive effects on people who use to carry heavy loads when growing? It's so the thing they said, so usa or spine, it recover so much. So you can't arthritis. Let me explain it to you. Say you two joints. Two joints are a move say. Into joint in move too much. Cartilage now what joint in it break it down a little. It break here. Not or body ne try say be fix it. And the way I fix it is say send it inflammatory markers, inflammatory cells, let's say and fix it. And no inflammation. I said what cut to on sabons are you ready no. And no inflammation because our body need try say be fix it. But our joint there's no fix. And so our body need say all fix it no. The one way of fixing is or put you down calcium. And so calcium then cause all the creaking and cracking and all that no. And no inflammation, no not for my pain a bemo because actually our body now yes fixes our problem now no and then no in turn it lead you to pain no. What so usha our body heal faster. Inti niema say me family mame and I'm a family. Now say you try immune sa may heal faster than no. Because say me young. That's the only reason. Inti usha all the stress I'll put your body through no a healing faster. But as you get older no ability for your body to heal faster no go way down. Inti who carry heavy loads when you were a kid, that doesn't mean say unyina baby sa arthritis bayo because it be crap usano uhili and in the issue for you bio. But say who carry heavy load as a kid, now so carry heavy load as a young adult, now so carry heavy load as an adult, then it will have a negative effect on you. Okay. It's mostly after your body's done growing. That's when you start really adding on all the stress that your body goes through. And so I would say probably around like after 18, 19, your body starts to really pile on the stress. Like, in your 20s, you're invincible, but then once you get in your 30s, things change. You don't heal as fast. Your body doesn't get rid of the negative effects as fast. And so the negative effects start piling up depending on what you're doing. So yes, continuing to carry a heavy load will affect you badly.
Dog, it was it. My friend Bell, I'm not so we are come back to the chat now. I answered the hip thing.
But I say, Dr. Justice Dennis, me question. The question, my main busa mami na Mr. My best from your experience. So 8 years ago, I have a surgery. I want the spinal. I think so the lower back, right? The reason was not 3 disc movie. It's not was severe pains. So she had this surgery. I think said they were able to fix those 3 discs in the lower back, right? Now, this is the question. The first 3 years and after the surgery, she was fine. Now, I said, pains in a baby. Now, this time, the first one, and we feel it, we are calling the name. Now, Sabani, chi, Nina, or Hono Science, Okohu and the doctor, or say, she has to go through another surgery. I think say why you can cry. And from your experience, advice, what would you recommend, please?
Well, first surgery, no, omuye fusion, and I say no omuye decompression, keke. The screws and the rods,
the screws, yes.
The screws and the rods. Okay, so omuye fusion. Okay. Anna, which levels am we at? Who remember?
Me pacho, me was me akasa.
Okay, mama.
Pacho doctor. Ay, omuye, ye no omuye mi lo. lower won't say lumbar surgeon. I take lower no 3 discs no baako a shift to call left. Now the torso no a stable, not another one so shift to call right side 3 and a woman I can see I can straight in on almost screen. And to my first 3 years and then I'm fine. So say pain was started a travel call. If my chin by my hip had travel call me left leg and so say then else in I am yana man into I didn't to me not says me to 1 block. And I did drew honey house I'm and I'm at some months so I'm not making yam yet to get a original when I'm stretch. This is a doctor me really may to me coy beside phone and was I am MRI be to a year and was saying a bus or a sorony be I sign I chiachiasa. It's a message here another surgeon I'm so no way. And no dear surgery they me trim and tea a dear being of a sign me no similarly a mental therapy. And to be a therapy bit to me upward. So make yeah, and who know more she am what and the pain we are near west.
Okay, Mama, if you don't mind me asking, what do you say?
But I'll say,
the doctor already. I don't know say can you possibly be a quafrewa? What do you know say? Nobody come behind the
That's okay. Yeah.
Is that okay?
Yeah, yes. That's yeah, I think so.
Thank you, doctor.
Me who am I so I have to say because I think I have an idea there also, but if I see it, I can better meet me on my better direction.
Okay, thank you so much. In the Bema in Saddam Sonora the amount. Thank you.
Yeah, that's it, mommy. Yeah, you did for me, Dr. Akasa. I train now for more than 2 hours in here. It said, yeah, answer questions now. What chat news we are ready, Master Mo. It take a question. In case you have a question, be a need be a phobia. Number mean there we are. No, Doctor Benjamin Abasua cry. Oh, my child, dear, might be a question between be a bit of one boy. But you see the time no I train a break. No, called you man or seven boy, you know. That's a question I had we are in the dictionary about every year. Doctor, you got hip pain, so or say on your hip pain, since or when the first born. The guy know what you say, ABI, you say, Akora, and that was his man, and about hip pain. I say, no, doctor say on your arthritis. Now, we here surgery. And I says over 45 years, and don't bust surgery, so I didn't have a shame. That pain, so no. Adjust in 9 nifanimu. So who do you advise about other man?
I think that so reading this and we need enough information.
Okay.
So this is another person I was saying because if it's a leg pain from leg because of leg arthritis or from back arthritis or from hip arthritis, I'm not sure based on this, and so I think that talking through it, I'll be able to better help. So this is someone else I'm in the casa offline. Yeah.
Offline. Okay. All right. Yeah. Anyway, this is a minimum busa question.
I know. I see.
Okay.
Sorry.
All right. Okay. All right. Anyway, the next question is so. Or say we name the condition crowd here, but if you don't know the condition crowd busa, so can the stasis recti contribute to spinal pain?
Contribute. So diastasis recti is when abdominal muscles not mature before no abs no. So we flex so abs are there's a space in between. the muscles in the center of your belly. This is when it open up once I get wide. It happens mostly to a mama or kasi too much, and I say ma after give you birth. So because muscles then you're strong and ma together build. Well, can it contribute to spine pain? Yes. So before, let me show you a images now of structures that support the spine. Abdominal muscles, you're one of them. And one of them, the most important, your rectus muscles, which is ab muscles. And so we'll be showing the six-pack, a six-pack, and a diastasis recti, and a six-pack, and a separated. That's the issue. Into strengthening your diastasis, your ab muscles, it be to me a help a stabilizer or spine. And in that, it be to me a help or prevent pain. Now, so what diastasis recti, that means either say muscle need too weak, and I say well belly are too big for muscles need to come back together. Because muscles, we have muscles that it sits here, it sits on top. Do we get a lot of fat in between? I won't say it push your muscles now away. Inti said, or diastasis recti because of abdominal obesity, that can cause back pain because having a big belly in general will cause you to have back pain. And so that I would exercise my belly to try to get the muscle strong.
Yeah, Dr. Edward Sepa, all the for I can just 2 minutes now about 10. Na Dr. Agyei pa say ne wase nebre ewo yon ho. No my addition say from a specialist one when you baby this is first gonna lie so and Agyei for be too much one ma on my side addition. Dr. Yamin Shida ewo to watch any nyansa any media what the adomi me say enche na kwhwe odwumase pa formally esa me boa. Yeah, it's yeah, kase game inshira wonu no kan na nimdia odi ama wono wonso no otimi edibi aboa ma hofro nso omo yare nso no etimi anya hode nyame inshira opi we de mamusa kwhwe e da usufre mpa so bia wono ke busa asa bia nda we di the question busa last doctor ba ko busa say wosua dia bi neurosurgeon na won fa ogidie end to a friend say actually there essential wodin. And also people with Adventist faith. Next thing now, say soon they produce sabri because in the picture they quite that. So what has kept you with your Adventist faith, price? New dia warning now.
Tough question. Thanks. Tough question. Well, to be honest with you, a medicine has threatened my faith a lot.
Amen.
Okay, it's threatened it.
It's threatened. Oh, man,
well, because a very tough to see people sick and say God is what made this. And I said, Bonsame, say, and I said, and the worst part is it was a cry or yes sick, and I was old brain tumor. There's no answer. I have no answer to it. And so, tough, something I may work it through, to figure out. And say, very, very tough. And I'll tell you, a lot of people in medicine will tell you the same thing. Say it's not easy when you see, especially kids, like, because I've operated on a 5-month-old with a massive brain tumor before, and it's like, who made this, and it always makes it tough. But with my upbringing, I know that God is there, and everything I go through, where I am now, and I know, He's always watched my back and protected me and helped me achieve what I need to. And so yes, I think everyone needs faith, because there are many times where I look up like, hey, help a brother out, you know. But it's been challenging. So yeah.
Yeah, I think it's
Thank you. I need it. I really do. I need it.
That's it. And my friend, I'm your first elder Paul. So.
Yeah. Yes. And to me, mom, my doctor, now you should be asked.
Yeah, you with me extra baby so, but I saw no. Yeah. Yeah, what that doctor as I said, be one my enough for the vampire man we are now said baby so aka ho.
Yo, opening your dasi, Mr. Dan, so your dasi. So we share a program since Sunday, Ukraine. Many are just a member of this great church. I'm not saying about when I suffer all the challenges, New York City challenges. And I want to focus on yes, who the main country already. On behalf of First Ghana Church, near Sopo, just to say, oh, I mean, no, Papa, I'm so proud of them and also all the family. I'm humbled to tell you, say, keep the faith. Now, Yame and I'm more do the do. Now, very paja more than the I will believe. So, the Hoshan and Sia. And as I from last year, Damas is somewhat transformation. Nipa was super doctors probably. Rachel saying, Yame, Idias of Yachi. I'm so proud of Mr. Danso and family. So, team, no, say, oh, my program species. So we can baby. This is First Ghana. Timu amonya SDA for and amonya yasoba. Mumra ni bedjem. You sit down kaka move home. The bomb pioneer should be so on behalf of Pastor and the elders. Nafe yasiase empire mabushia omo hoaka. Munya nsai dina yidi ayo ho kakra bet. Yame ho otiase. Chobaye chiere. Mumya mompaye. Two for us for Radi any within Yehoah and Ray Darcy Pa, the Wayamo suffer. Now, one may am ranting in the four, the Maba one in the four, who the infant Nawasi, which is one Cassana who will do a suffer. Now, in some nine so Pabuana Behan, a boy home by said the way it is. It is so who so Peja Justice, Agyei, doctor, any family in Abu and teach you Wakua. What bound in dear were real said, my dear, or Baquaco shed market Siena and Casasi, or Philadelphia. The sum of both winning in mind. The Oko Bia or India Oko face challenges there and say, I'm probably back. Now, I don't sound say one Casawa protect me. My auntie and Cabino, I am what crown as said the Otiepo. Now, I shall win. The Session Coquans Bono, near Baho Bank. My body bianca on my yam and auntie. A Jawakua, himself will yet say, I'll be Dawasi. With the other say, the world are doing to me, and you look at say, it will be our friend, a soul now, and more. Now, housing on the more before Bantimore, near and feast as him. And your uncle, my Timmy Brew, I saw you, Agyei. A Jawa models out of company for your ammunition. That's it. The bus ever more so I crack it was a obey a doctor, and now doctor. Yeah, Fakura so better, sir. Instead, my idea over Coswell. I didn't really have a quack of it though. So, cook one so ya the opinion drew sending a family bowing. As someone see a tree in Baha, it won't send me in town to ya again. I mean, say, the cough for the sir. A Jama power and got dead in the crazy miles. The Bushia, a real hope, your horse on the mine. As I think, yeah, the better same way, Jenny saw the kind. Now I am for beyond 2 years and showing. After week, you would my dear. The saw my and feed that. I just your queen and the BRN. My aunt said any other addition. Young family and bra. That's somewhere see exercise named Janny. Yeah, can no one there popping every night. Just say, you see a friend you did last year. So there was my time. May that's so up way. Yekoda here so for Yesu divinity. Amen.
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 There was it. And the doctor answered there was it. After this, no, a bear casa behind the scenes. So, Yamisha P. No one sending Muncha walk in name. Najidi for and then Bediano, a hat and EDBC. Now may come say what chance on that day. Yambo, it's not. You back when I'm in your real home asem. Skin. The wasem Yambo, it's not. Yebeka. Inti Yama imiti inquired Sessra. And big caps there, idea when I'm in and when I'm in Sao doing Yambo, it's not. Yebeka home asem. Inti Momo den so Yambo, it's national. Yebeba. And yet, now make us say, Yamin so na dri. On my announcement, on me a home by, on ye free a townful and some. No me a home ding, which not any part. Young queen muscle and some do fear as some dream. I mean, say, you know, no one saying say or now do munti. Amen. And yet,
Amen.
Amen.
And ye miss pa.
Miss Pa. Yehovah, every known term.
Bye, Jay.
Amen.
Amen.
Everyone, thank you so much.
Welcome.
I mean, Papa, my idea.
Amen.
God bless you. Morgana, so for a champion in many program no para.
Trail